And with that, the range of patient ages, life stages, levels of trust in treatment, how do you approach encouraging patients to adhere to treatment regimens that can sometimes be very complex?
That's a great question, and it takes all of us is
Mm.
the answer. So, I never, never, never want patients are people, okay? And I've been a patient before, and everyone has. And I don't ever want people to feel that they're alone. And with diabetes, we have multiple ways to include family members and support systems and friends to where people don't feel alone. I usually do include, if there are partners or family members or a close friend or a neighbor, we we kind of bring them in as part of the care plan so that they understand the disease process, and that helps tremendously. We see this is a big part of population health and just community partnerships, even patients' faith based and community organizations, and trying to kind of meet them and making sure that those spaces understand their disease process and they're getting the help they need, like full circle.
So, with that being said, too, just playing into that, let's talk a little bit about technology and the role that that plays in your work and in patients being actively involved in understanding their disease and actively involved in their treatment.
So, diabetes technology is one of my favorite things. This is 2025. And as you know, there is just an explosion of multiple apps and modalities, AI, multiple ways to kind of just make people's lives easier and help them engage and help them be a partner in their plan of care instead of like having a dictatorship. Like, no longer are patients coming in and you're saying, this is the way we're going to treat you and this is what we're going to do. It's really them kind of seeing. So I certainly use tons of continuous glucose monitors, or what's called CGM. CGMs are a type of biosensor, and they basically are on top of the skin. And we do have implantable CGMs as well, and they provide real-time glucose data. They connect to smartphones, or they connect to receivers or readers for those that don't have smartphones. And the patients can see their glucose live in real time. And it helps them because they can see how certain activities, certain foods, or maybe certain portions or amounts of foods are really impacting their glucose. And then they can also see and log like when they take medications, and they can see the impact of dosing and like kind of make a plan and see if something's helping or not helping. So it helps establish trust without even like being there. So
Mm.
I love diabetes technology. I think it's extremely engaging, and it's really, really helping patients be more in charge of their care.